Captured effortlessly, that's the way it was. Happened so naturally, I did not know it was love. The next thing I felt was you holding me close. What was I gonna do? I let myself go, and now we're flying through the stars. I hope this night will last forever. Oh, 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 oh. Ain't nobody loves me better, makes me happy, makes me feel this way. Ain't nobody loves me better than you. I've been waiting for you.
Hi, this is John Cullen. Welcome to another episode of Hypothetically Speaking. In this episode, I'm rejoined by my friend, Kurtis Bay, who's been on the show about 9 months ago, and Kurtis is back on the show now. Thank you, Kurtis, for joining us.
Yeah, thank you, John. Always a pleasure to visit with you.
Great to have you back on the show. I know that since you were on the show last, you have connected with a number of people, some of the big names in sort of the COVID counter-narrative world, if you will. And you've had an opportunity recently to get involved in a pretty big event that was taking place. And I think you got to meet some senators or Congress people and some big-name doctors. And you and I have stayed in touch since we recorded that episode 9 months ago. And I wanted to connect with you again and find out, what has been going on. Tell us more about what you've been doing and what are you seeing? What are you hearing? Can you tell us about that event? So I'm just going to turn it over to you to kind of catch us all up, if you don't mind.
Yeah, thank you very much. It's always a pleasure to be able to hang out with you. I appreciate the integrity in your approach and the way you dig a little deeper and around the edges rather than some of the surface stuff that everybody takes for granted.
Thank you.
So it means a lot to be able to visit with you about this stuff.
Thank you.
The event that you were referring to happened on May 25th of this year in Arizona, in the well of the Senate, for lack of a better term. The Senator Shamp, who was I believe her title in the Senate, other than being a senator, she was the chair of the Health and Human Services Division. So she put together a panel of experts, including other senators, to do a deep dive into Arizona's response during this coronavirus pandemic, from what they referred to as the public response from public health directors in different cities and counties to the schools, the businesses, all the different mandates that were shoved down someone's throat, both from a state level, an agency level, a federal level, and then just liability and risk, how businesses responded.
So let me test my understanding. So I just want to, for the audience's sake, I just want to make sure we're all on the same page. So it sounds like this was a state Senate meeting in Arizona, and for the people who didn't get a chance to watch the discussion that we had 9 months ago, you live in Arizona, right? You live in the Phoenix area, the greater Phoenix area, and so attending something like this sort of was natural for you. But it brought in a bunch of big names, like Peter McCullough came into town, right? A bunch of the big name doctors who've been on all the TV shows and whatever. So even though it was a local thing, it seemed to attract a lot of attention, right? Was Thomas Massey there? Was Massey one of the guys involved in that?
Not Massey, but at the federal level, you had Andy Biggs.
There you go, Biggs, right? Biggs is right. Okay, so yeah, so all right.
Bosar.
Okay, so there we go. All right, so that's what I want to understand, that because you got big name federal people that came to a local Arizona state Senate thing, and the person you just mentioned a minute ago, that's a state senator, correct?
Right.
Okay. All right.
Correct.
All right. We're
Senator
on track.
Shamp. And to your point, I'm sorry wasn't more clear, but this was the first joint sort of look or investigation, if you would, at the response for Arizona from both the federal and state level. And it was in the Senate. And as you mentioned, there were several prominent people that most people would recognize from, TV or other podcasts. Dr. Peter McCullough, Dr. Corey, I'm trying to think of the Aaron Siri, I think was one of the representatives, legal representatives that was there to talk about the protocols and how they were, and then the PrEP Act and the CARES Act indemnity model that they were all hiding behind. So it covered the gambit from both like I said, the public response, the state level response, and then how that all affected people. And it gave us an opportunity to put stuff, if you would, for lack of a better term, on the record. Mm-hmm. I was the first, and I'm thankful for this. This isn't me. I'm not blowing my own horn or anything like that. So please don't take it that way. I was grateful to be the first victims advocate in a joint session of Congress to be able to testify about the conditions of what took place.
Well, I want to get to that, but I don't want to get to that just quite yet. And it is great that you got to go first. That's awesome. Yeah. We haven't really focused a whole lot on the numbers coming out of Arizona. And so the reason I'm bringing this up is I'm not that familiar with Arizona's response. I remember you had a governor named Ducey, and then now the governor is Katie Hobbs, and I did an episode making fun of the old Katie Hobbs versus the new Katie Hobbs. I did that about, during when she was going through all that. But that's kind of all I know. Was Arizona's response to COVID remarkably bad like New York? Like New York's got 80,000 people dead, which is more than Pakistan, more than Bangladesh. I haven't paid a whole lot of attention to what was going on in Arizona. I was mostly making fun of New York and California. So
easy targets.
Well, yeah, and I don't like either of those guys. So I don't really care for that Doug Ducey guy either. But to tell you the truth, I just wasn't really that focused on what was happening in Arizona. The big states were New York, California, Florida, Texas. That was kind of the focus at the time. So catch us up, if you will. What happened in Arizona? I'm going to pull up the numbers and put them up on the screen for the audience so they can compare Arizona's COVID response to other countries like Bangladesh or Pakistan, and how did Arizona do compared to Nigeria, Ethiopia, places like that. But can you tell us as a resident, what the hell happened? Ducey was the governor, right? And he's a Republican, but he wasn't a Trump Republican. He was like one of these anti-Trump Republicans, it seems. So there was a little bit of tension there. So what was the experience living in Arizona going through COVID? What was the reaction and the response? Pretty bad? I mean, I don't know.
So I think that's a great question, and I think the answer is probably a couple different avenues. The government or state response was not nearly as drastic as New Jersey, New York, California, some of the other states out there that were locking everybody down. We're mandating 5 masks and 3 shots and closing your restaurants and businesses and things like that. They were much more open here. Even at the education school level, they were allowing religious exceptions, and sports were still happening and things like that for kids. So it was much more open. The question, or the unique position that Senator Champ took in this wasn't necessarily to say Arizona did an absolutely terrible job, even though there were plenty of failures to go around within the state. The reason that she really drove this was she wanted to get expert testimony on record about how we got here, what happened once we were here, why hasn't it changed? And what effect did that have on her constituents? In other words, the Arizona people like me, who was really affected, because we're these people, we don't never get heard. The only time we're ever heard is if we're on a interview with someone like you, where we get to tell stories or statistics, and usually that's just lodged in the complaint file, and it's thought of as the angry spouse of and they're crazy if for saying all this stuff. But she wanted to have an opportunity to say, hey, I want to expose all the things that took place, from both the jab and what we knew about the jab, to the incentives around the hospitalization and the treatment around it, to what actually took place in the hospitals. And let's talk about those things from a little higher view than just to say, the public Maricopa public health person did not do a very good job of communicating mask variances with the schools. So it was a much more broader opportunity to have a deeper conversation. And I think she did it specifically. I won't speak for her, but I think based on the conversations I had and the feedback I got from her, it was truly a feeling in her heart. She was a nurse prior to being a senator, and she had witnessed her own mishaps in the hospitals and the treatment of particular patients. And she wanted to expose this, and knew that the only way she was going to be able to do it was if she started at the beginning and went through the whole thing over a couple of days, that she would be able to plant the seeds of, basically the I don't want to say the conspiracy, but the level of interaction amongst agencies to provide a particular outcome. Much like a cartel, much like, and why you and I have had RICO and racketeering conversations around this. So that was her motive, I believe. And being in the position she was in, she was able to do it in the Senate with other Senate people to partner with her and get the top experts in the world to come in and speak specifically on the different knowledge base that they had, and the other testimony that was given to the federal agencies or the federal Senate and House during this pandemic. So, number one, get stuff on the record in testimony under oath by a Senate, by experts. And then from there, be able to build a case for how we got here, why we stayed there, and why we're still doing it today. So that was kind of the conversation we began having with them. And there were obviously lots of victims that wanted to sign up and come in and tell their story about their loved one. The difference was you couldn't do that. The difference why I was chosen was you couldn't do that. There's too many people. So you just end up having, a big rally of victims, tragedy stories all day long. And it would never advance or elevate the conversation about how we got here, or evidence-based medicine. Why did Rhode Island have more dead than Nigeria? Why did the West have way more dead than anywhere else? All of those sorts of things were never going to get talked about if all they did was allow people to come in and tell their stories. So she had to filter that down to, say, I want to speak specifically on the topics of vaccine, and I want to talk specifically about the topics of the protocols in the hospitals. So I was the victims advocate for the hospital protocol, and they had another individual come on the next day that talked specifically about the vaccine injured and what that looked like. So it was a 2-day event, but it laid a lot of the groundwork and exposed a lot of the things that you and I already know. But this time it was on record, and it gave an opportunity to be able to, for, sort of like a legal team would do, or something like you would do. You're very good at sort of planting the seeds and inquiring about something that you kind of have an idea, or maybe you already know the answer to, but it allows the person doing the talking to either confirm or deny what it is that you're asking. So I'll give you an example and then we can move on. But in the example I would use is in my wife's case, in 3 days, when we asked for a transfer and they acknowledged they had a transfer, she was ventilated within 12 hours and refused transfer. And they threatened to take medical power of attorney from me. So I would have to get a temporary restraining order in order to stop them from doing that. Now, everybody that hears that would say, that's crazy talk. That guy's a nut. That never happened. I know it never. The hospitals don't act like that. But if you say that, and then the senator turns to the expert, Dr. Peter McCullough, and says, Dr. McCullough, in your experience over the last year or so, is that common? Did you happen to run into that or see that in your practices? He has a choice of what he can say yes or no. And if he says yes, guess what? It's testimony on the record from the expert that is exactly what happened. It's not a sad story from a victim.
Well, for the audience, it's important that the audience understands that your case was unique in that Tami was taken through these COVID protocols despite not having tested positive for COVID. And so, in some ways, it's so bizarre. It's as if the hospital and the hospitalist, to make it specific, had an agenda that, regardless of what the test results are going to show, they were so motivated to go down this certain pathway. And the fact that your wife never tested positive for the SARS-CoV-2 virus, and yet they followed these protocols. That's the part that, the people who watched the interview that we did were just so blown away by this. Like, how does this even happen? And I hope that was the reaction when you had the opportunity to testify in front of the Senate. I mean, did the audience understand that Tami didn't test positive for SARS-CoV-2? Did they understand that?
Yeah. So again, great point. In fact, it was the entire reason why I lobbied to be the person giving this testimony, was that she was a unique. I say it's not uncommon, but it is unique. She never tested positive for COVID. She was diagnosed with pneumonia in the emergency room that day. And yet, to your point, regardless of what her diagnosis was, they were going to run her through this, cattle mill of, they were going to move from one step to the next step to the next step through this 5 metric system, basically. And they were going to kill her, or she would live, one of the two, but they were not going to pay any attention to what got her to the hospital that day. And they didn't care whether she tested positive or not. And my goal was to say, do 2 things, just for reminding you and I of the conversation and your audience of what you and I have talked about over the last 9 months or so, is I believe that because of the protections under the CARES and PrEP Act, and we can talk about that in a few minutes, and I hope we do, these hospitals are indemnified for any action. And I'll explain it this way. They could have stabbed Tami in the face with a butter knife, and I could not do anything to them legally. I couldn't sue them. Murder wouldn't come, nothing, because it was all under the public health indemnity of the PrEP Act and the CARES Act relating to COVID. Another example would be if you were transporting medication, a vaccine, in your car, and you hit another driver head on and killed the mother with a pregnant mother with 2 kids in the back. Again, you would still fall under this indemnity because you are part of the public health delivering vaccines that are supposed to be part of this. There are so many loopholes that allow these people to get away with murder, literally.
Did Siri brought that forward? Aaron Siri is the one who shared that? Yeah, that's wild.
Yep.
That's wild.
So the point, I wanted to be on there to say that I wanted to be able to tell Tami's story for the purposes of drawing out the inferences that you and I have talked about with RICO, racketeering, and then get around this PrEP Act and this indemnity that they have, and have a different conversation at a different level about how they operated and why they operated. And the protocols were a key element. So I wanted Dr. Corey and Dr. McCullough to say on record under oath that the protocols were created by the ABC agency, you name whatever agency, CDC, it doesn't matter. But those agencies created those protocols. They knew that it would be a detrimental outcome for the patients that were going to be involved in them, yet they decided to go ahead and do it. And then not only did they decide to do it, they incentivized the hospitals to operate under those protocols. And here's the unique piece about that is this, unlike a car dealership, that when you sell a car, you get paid a commission for selling the car. This was like a drug dealer program where they fronted you the drugs and the money you needed to operate. And they told you, if you don't perform and deliver next week with the right receipts, we're coming back for the money. They paid the hospitals in advance, hundreds of millions of dollars to these hospitals to operate under a certain guideline and say, for example, ventilation in Arizona was $46,000 or so. Remdesivir, 20 grand. Sedatives, 10 or 12 grand. In my wife's case, she was ventilated twice. So she was diagnosed with pneumonia. pneumonia, a $5,000 invoice or a receipt. COVID protocol, 15 days later, $500,000 bill. It didn't take long to figure out that this business model that they had adopted was why they changed all their historical business models overnight. They jumped into this saying no problem, and I wanted to be able to get that on record. Tell me, Dr. McCullough, was the question from Senator Shamp. Tell me when the agencies, when the federal government knew or implemented this incentive plan. He said October of 2020.
No.
He said they put the that he testified, his testimony, may not be the exact date. His testimony was that the incentive structures were put in place in he testified in October 2020 that they were put in place in 2020.
Well, we heard from Dr. Scott Jensen. Dr. Scott Jensen came on the show, and he was on Laura Ingraham after
the same thing.
Yeah, well, he said that they had already come to him and said it's $13,000 for an admission. We triple that to $39,000 if you intubate the patient. And then if your facility, if you're one of these larger operations, like a Kaiser Permanente or whatever, one of these bigger hospitals, and you have 100 admissions by a certain time in June, they were going to receive another $77,000 bonus if they had over 100 admissions.
We found out last week that the changes in reporting COVID-19 cases in hospitals and ICUs were being done by the Minnesota Department of Health. You put out your Facebook video. We were able to show some of that. Your first reaction when you heard this was what?
If we are trying to be transparent, if we are trying to include Minnesotans in the conversation, why does the Department of Health do this?
And so he was telling us this, I think it was in April of 2020, and that there was like a June deadline, so that a lot of the hospitals, if they didn't get to their 100 admissions by June, whatever the date was, I forget the number, but it was sometime in mid-June, that they weren't going to receive that extra $77,000 per admission. Right? Now, if Tammy's chart was marked apparent COVID, meaning they don't have any test results. But think about this. Early on, when this thing first started happening and people started dying in March of 2020, did we even have test kits back then that worked? Because the CDC told us that they were contaminated and they screwed up and they had to redo everything. So how did we know that those people were really dying from COVID? And how would they possibly take Tami through the COVID protocol when none of the test results were coming back that she tested positive for SARS-CoV-2? And they just said, well, we're going to do this anyway. And so I got to believe that's why they put you in front of everybody, because it's one thing to put people through this horrible protocol and give them remdesivir and all this other stuff, and they have COVID and they died. It's a whole nother thing to take somebody through this protocol that doesn't have COVID. It's like giving somebody chemotherapy that doesn't have cancer. What the hell would you do that for?
Show the picture of my wife the month before this happened, if you got that. That's exactly the case. While Scott Jensen would have been a great, Dr. Jensen would have been a great candidate to be on this panel, to be able to speak specifically to some of the dates probably where this was instituted. All I wanted to get was the guys that were there to admit that this was something that was implemented, and the medical teams around the country knew it. Mm-hmm. And so they were making decisions based on the payment structure and the incentive plan, not on the condition of the patient.
Absolutely.
And that's what I wanted to get on record, because say it.
Yeah, well, you're the example of it. I mean, how the hell, again, it's like giving someone chemotherapy that doesn't have cancer. Why would you do that? And so it's just so egregious. I mean, everybody was so angry hearing your story. I've never had a reaction like that to anything I've ever done. I mean, it moved, thousands of people were moved by that. So
a brief, just if you don't there. So Tami was a healthy 59-year-old, sexy, athletic, no drugs, no alcohol, no tobacco. medical underlying conditions at all, and goes into the hospital on January 5th, dies or is killed January 20th. Ventilated twice, on 4 liters of oxygen upon arrival. Within 72 hours of us requesting her to be transferred, they block the transfer, ventilate her. They sedate her the entire time for the first 2 days, and they don't tell us that. But then they ventilate her within 3 days. When she comes out and she's in CCU, they promise that she'll be able to go home any day as soon as she can walk the hallway on her own. She's on less than 7 liters of oxygen at that time. They won't let her leave still. So they say she has to walk the hall and do some other things. But long story short, we go through that battle for a few days. They move her back to the COVID floor. I hide in the room and in some cases just sweet talk my way into being able to stay with the different nurses. She had 21 nurses in 15 days. Over half of them were from outside the country, and were travel nurses on contract, which is again part of the incentive structure built into the protocol. Right. And then they on the 18th day of her stay, or the 13th day of her stay, they take her back to ICU to ventilate her again because she didn't meet a particular metric. She was having a panic attack, and her heart rate and her air flow was being maxed out. And so there was a time frame that they were working under in their hospital protocol that if they couldn't resolve it within a minute and a half or whatever, it was an automatic transfer to the ICU. So there was nothing I could do, even though I was standing in the room physically, trying to protect her. They were going to take her, and they did. And they ventilated her again. 24 hours later, they call me to say that she has a rip in her organs that is leaking into her cavity, and that they have to perform surgery. When I get there at 3 o'clock that morning, they say, sorry, we can't do surgery because if we turn her over, she's going to die. If we don't do the surgery, she's going to die. So just say goodbye. That's the story in a nutshell for your audience, to be reminded about how we got here. A healthy, beautiful woman who had no underlying medical conditions, and active, athletic, sexy girl living the best life ever. Was a minute we were put into that hospital, I was labeled combative. Cops were called. I was trespassed, and they went into a protocol that we didn't agree to and knew nothing about, for the sole purposes of building a portfolio of revenue against my wife's health.
It's just absolutely outrageous. There's an aspect of your story, though, that I want to get to because it's really critical. And I want to talk about some of the specifics here, because I have a feeling that there's a couple 100,000 people that have been through what you went through and just haven't had the wherewithal or the ability to come forward and talk about it.
Talking a mad game. Wish I was sipping on what you were having. You play it up, it's a method, a habit. I hear it all the time, but nothing that you're doing can back it. Here we go again. They wish they had me and they bitter. They be bitter. It's noise. The only thing I call a thriller is the silver. I'm only ever gonna be on top. I make the money and I can't stop. I make the money and I can't stop. Oh, I can't stop. Oh, no. You think about me? No. I know you think about me. Locking in my step. I'm charged up by the staring that I get. You can flex, but I'm cashing in more checks. You talk it up all the time. You're folding them, but I gotta stack it. Here we go again.
One of the things I want to talk to you about, and I want to get a little bit specific because I think it's one of the core elements of what I know of Tami's case, and that is what brought you guys to the hospital in the first place was that she was feeling run down, and that when you got to the hospital and they checked her blood oxygen level, it was remarkably low, like they were kind of shocked. And you and I talked about that a little bit after we did that show. I shared with you that video of Dr. Cameron Kyle Seidel and the video of Dr. Zach Bush talking about this hypoxia thing. Can you tell the audience a little bit about Tami's condition when you arrived at the ER and this blood oxygen thing? Because I think this is really the heart of the matter here.
This is Dr. Cameron Kyle Seidel, ER and critical care doctor from New York City. 9 days ago, I opened an intensive care unit to care for the sickest COVID-positive patients in this city. In these 9 days, I have seen things I have never seen before. In treating these patients, I have witnessed medical phenomenon that just don't make sense in the context of treating a disease that is supposed to be a viral pneumonia. 9 days ago, I presumed I was opening an intensive care unit to treat patients with a virus causing a pneumonia that was ravaging lungs across the world, starting out as something mild, cough, a sore throat, and progressively increasing in severity until ultimately ending in something called acute respiratory distress syndrome, or ARDS. This is the paradigm that every hospital in the country is working under. This is the disease, ARDS, that every hospital is preparing to treat. And this is the disease, ARDS, for which in the next 2 to 6 weeks, 100,000 Americans might be put on a ventilator. And yet, everything I've seen in the last 9 days, all the things that just don't make sense, the patients I'm seeing in front of me, the lungs I'm trying to improve, have led me to believe that COVID-19 is not this disease, and that we are operating under a medical paradigm that is untrue. In short, I believe we are treating the wrong disease, and I fear that this misguided treatment will lead to a tremendous amount of harm to a great number of people in a very short time. As New York City appears to be about 10 days ahead of the country, I feel compelled to get this information out. COVID-19 lung disease, as far as I can see, is not a pneumonia and should not be treated as one. Rather, it appears as some kind of viral-induced disease, most resembling high-altitude sickness. It is as if tens of thousands of my fellow New Yorkers are on a plane at 30,000 feet and the cabin pressure is slowly being let out. These patients are slowly being starved of oxygen. I have seen patients dependent on oxygen take off their oxygen and quickly progress through a state of anxiety and emotional distress and eventually get blue in the face. And while they look like patients absolutely on the brink of death, they do not look like patients dying of pneumonia. I have never been a mountain climber, and I do not know the conditions at base camp below the highest peaks in the world. But I suspect that the patients I'm seeing in front of me look most like as if a person was dropped off on the top of Mount Everest without time to acclimate. I don't know the final answer of this disease, but I'm quite sure that a ventilator is not it. That is not to say that we don't need ventilators. We absolutely need them. They are the only way at this time that we're able to give a little more oxygen to patients who need it. But when we treat people with ARDS, we typically use ventilators to treat what's called respiratory failure. That is, we use the ventilator to do the work that the patient's muscles can no longer do because they're too tired to do it. These patients' muscles work fine. I fear that if we are using a false paradigm to treat a new disease, that the method that we program the ventilator, one based on a notion of respiratory failure as opposed to oxygen failure, that this method, and there are a great many number of methods we can use with the ventilator, but this method being widely adopted at this very moment in every hospital in the country, which aims to increase pressure on the lungs in order to open them up, is actually doing more harm than good. And that the pressure we are providing to lungs, we may be providing to lungs that cannot stand it, that cannot take it, and that the ARDS that we are seeing, that the whole world is seeing, may be nothing more than lung injury caused by the ventilator. Now, I don't know the final answer to this disease. I do sense that we will have to use ventilators. We will have to use a great many number of ventilators, and we need a great many number of ventilators, but I sense that we can use them in a much safer way. In a much safer method. That safer method challenges long-held dogmatic beliefs within the medical community and among lung specialists, which will not be easy to overcome. So I urge you, for those of us, if you are out there, for those who work bedside, I urge you to speak up. We can change this. I thank you all for listening. Please spread the message and stay safe.
Yeah, she had been complaining of being fatigued for maybe a day and a half. I mean, she was under the weather, and but eating, wasn't gasping for air, didn't have a fever, like a cold or anything else was going on. And we thought for sure that maybe she had some form of pneumonia or walking pneumonia, whatever. But when I took her to the hospital that day, if you remember, I tried to take her to the urgent care, it didn't work out, and we ended up at the hospital. She was at around 79 O2 level, so it was below 80, obviously, and it was in the high 70s. But she didn't have a fever. Again, she wasn't hacking or coughing, wasn't congested, just extremely tired, very fatigued, and didn't really have an explanation, neither one of us, for why that was occurring.
But once we find out that her blood oxygen is 79%, and hindsight being 2020, I mean, you and I didn't know anything about all this stuff 4 years ago. So hearing that her blood oxygen was at 79%, a lot of medical professionals follow me and watch this stuff. And so a lot of nurses and physicians and pharmacists even were commenting and saying, a 79% blood ox, how was she even conscious? Like, that's beyond hypoxic. That's so low, it's kind of crazy. And then I shared with you a video from Dr. Cameron Kyle Seidel, one of the physicians who was in New York City early on, and he seemed a bit panic-stricken. He was upset, saying, we've never seen anything like this. These people's lips are turning blue, and they don't need to be ventilated. It's not their diaphragm. They can breathe, but nothing's happening when they're breathing, kind of like they're up at 26,000 feet. It's like an altitude sickness thing. And we heard the same thing from Dr. Zach Bush in Hawaii. Couldn't be further from New York. Dr. Zach Bush in Hawaii recounts the same thing.
It literally says the patients turn blue and then have to wait until their lungs eventually fill with fluid, and then they die. The course of events there is very important. They first turn blue before their lungs have fluid in them. And so there's not a respiratory failure that leads this thing. And then eventually, with fluid in their lungs, they develop pneumonia and die. This is exactly what's happening with this COVID strain. So another coronavirus presenting with hypoxia, which is a loss of oxygen in tissue. So the patients are presenting blue and with these remarkably low numbers of oxygen, in the bloodstream. And yet a lot of them look pretty comfortable. They're not breathing fast. They're not, in any distress. And so the doctors are freaking out, trying to figure out, why is this patient sitting here talking to me with an oxygen level this low, blue in the face, and going into multi-organ failure? Liver is the number one thing when they screened. There was a nice article that showed what is the initial laboratories of 5,000 patients presenting with COVID like symptoms in New York. Of those 5,000 patients, the vast majority didn't even have fever. Of those 5,000 patients, the vast majority didn't even have fever.
I'm afraid that there are thousands, if not hundreds of thousands of people who suffered from the same condition or affliction that Tami was suffering from, that also had this hypoxia, that may also have not tested positive for COVID.
I completely agree, and I remember the conversation and video that we shared. It's odd that we've been together for 40 years, Tami and I, so we've been through tons of different sicknesses and ailments for each other. And I honestly never was worried that this was something that was not, that she was going to get taken out from. The fact that she still had her faculties with her. We walked down the hallway together to go get in the truck. I got her in the vehicle. We were joking when we pulled up to the urgent care about being out of coffee and what the podcaster on the show we were listening to was talking about. She wasn't out of it, and so. But let's be clear, Tami was sick. Never once have I said she wasn't sick. She was sick. She was definitely sick and needed help. But this low oxygen thing, to your point, I think has been one of the commonalities. And then the instant methodology for modality about how they treat those people is they immediately try and ventilate them immediately. And to your point, that doctor made it clear that that wasn't the right response, but it was how the doctors and the hospitals were acting.
Let me ask you this: you said you guys have been together for 40 years. You've got kids. You know, you've been in hospitals before, given birth. I imagine you didn't do it on the farm. So, do you believe that Tami would have received the same pathway of care had there not been monetary incentives for certain things? In other words, if this was just the way it used to be, if things were just kind of normal, do you think they would have done all this stuff to her, or do you think this was primarily driven by the monetary incentives?
No, I think it's 100% driven by the incentive strategy. And in lieu of, there's a document out by ADAA, a medical journal, that 100-year-old medical journal, that exposed the incentive pathway that I mentioned earlier, that these chain hospitals specifically were given money in advance. So as early as February of 2020, they were getting these checks advanced to them saying, operate under these conditions, utilizing these 5 protocols, and provide the receipts at the end of the month or the year or whenever the receipts were due, and keep the money. If you don't meet the receipts, you're going to pay us back. And so it looks a lot like a drug dealer. The cartel comes in and fronts you the drugs and says, here's the operating capital you need. I don't get it back by Friday, I'm going to break your legs and, take your daughter out. So it looked a lot like a cartel. But to your point, the answer is the rural hospitals did not have the same high level of death that these chain hospitals did. And I believe it was because, one, they didn't, obviously they may have been approached on the same incentives, but they probably declined. And I don't have any information or data to support that. But my theory is that if you're in a small community and you live with the people and you see them in the grocery store, you probably want to treat those people a little bit differently than the ones that are just a toe tag.
Maybe that's why they're bringing all the nurses in from Ghana. And
that's part of the protocol.
Eswatini, yeah.
I sent you a list of the 25 commonalities just a little while ago that are the consistent commonalities across the board for these people about how they're treated upon admission. They're all the same. Doesn't matter their body type, doesn't matter whether they're vaccinated, unvaccinated, doesn't matter what medical conditions they're on, doesn't matter. They don't care about these conditions. You could have heart failure, kidney failure, doesn't matter. They're going to treat you this way because they need to check the box for those incentives. And that's what they do. And in fact, Senator Shamp asked me point blank, if you think that, if you had not taken Tami to the hospital, do you think she would be alive today? And I said, yes. That particular statement has had over 10 million views.
Tell us more about that. So 10 million views, where? I can't imagine.
I sent you the link for that, but
okay.
On Twitter, Rumble, on a bunch of different social media. I got the email from her staff that said, just wanted to let you know that conversation you had with Senator Shamp has got received over 10 million views.
That's
so I sent it to you. I sent it to you with the data to support it, but and the links for that too. But the point is, she's asking the question, and the reason that question came up, I believe, was because, one, she had an experience in the hospital that she wanted to expose. Two, she wanted to give an opportunity to be able to put on record that these things were being done for the purposes of incentives, not for the purposes of health. And so asking me that question, is an obvious, I'm going to say exactly what I said. I don't think she would have. I think if we'd have been in a different city or town in a smaller rural community, I believe that the doctor probably knew our name, probably would have treated us differently. This hospital, they didn't know our name. They didn't know anything about us. The hospitalist was there for that purpose only. I think that's even a question I asked was, when did hospitalists become, such a prominent piece of the hospital's operating structure?
Kurtis, can I ask you one question?
Yeah.
Thank you. Do you believe that your wife would still be alive today had you not gone to the hospital?
Yes. Yeah. If I would have known what I know today about concierge nursing and the different treatments that were available, there were so many, if she had COVID or Omicron or whatever it was, that, we could have done something different. But I wish that I'd never taken her to the hospital. And then to be labeled combative, and I'm 6 hours and isolated and trespassed and all that stuff. It's tragic.
Thank you. I ask you that question because I genuinely want to know your answer. And I think I knew what your answer would be, but I want to point out the fact that we have lost faith. And not just the patients. There are healthcare providers that have lost faith. And we have to fix it. And I will not stop until we do.
Oh.
And that you have my word, sir.
Thank you.
I mean, I never met a hospital. I had 7 surgeries in 30 months prior to this on my spine and my extremities, my neck, my back, my shoulders, my elbows, my hands. I had and hip. I had an accident. It was terrible. 7 surgeries in 30 months.
Wow.
I never once heard of a hospitalist during that period. No hospitalist came and visited me. No one, nothing. It was a doctor and a surgeon and his team came and talked to me about my procedure and what was going to happen. When we walked into the room for Tammy's treatment, that was exactly what we expected. Was that we would be met by a doctor, a team of nurses. They would say, "Hey, Tammy, you're sick. We're going to look at you. We're going to test you. We're going to do no evidence-based medicine, which has been the traditional standard for hundreds of years in the medical industry. No evidence-based medicine tactics were used in this protocol." Yeah. And I don't mean just on Tammy. To your point, hundreds of thousands of people all across this country were under the same thing. And as a theology, if you said the protocols are how we're going to go to market, this is what we're going to do, they never once looked back at evidence-based medicine to see if it was working.
Well, so that's for the people who actually have the affliction, and then to use this on people who don't. Again, I'll use another analogy. It would be like giving the AZT treatment to people who didn't have HIV.
Right.
It was bad enough to give it to people who have HIV. Why would you give it to somebody who doesn't have HIV? That's what they did to Tammy. One of the frustrations that I have is that the data that I've been tracking illustrates that there were 4,000 people dying every week in January, February, March of 2020 before COVID arrived. And that was kind of historic in and of itself. The United States has never had that many people dying of PNI, which is pneumonia and influenza, on a weekly basis for that many weeks in a row. And then there's then 2 stories, and this is where it gets uncomfortable and weird. One story that we heard from Dr. Fauci is that influenza disappeared. He's like, yeah, it's remarkable. He's talking to Brett Baer, and he says, Brett, it's amazing. There's no influenza. There's no influenza in Australia. It's really weird. We don't know what it is.
Yeah. And, because of what we're doing with coronavirus, we haven't heard a lot about the seasonal flu. We lose 30 to 60,000 people from the flu. Has that gone down dramatically?
Extraordinarily dramatically, Brett. And in fact, that is a very good testimony to the efficacy of wearing masks, avoiding congregate settings, and keeping distance, because we did that during this late fall, early winter, and the level of influenza in the community is remarkably low regarding comparisons to other years. Our Australian colleagues had the same experience during their winter, which is essentially our summer. When I was talking to my colleagues in Australia, they were saying, Tony, we don't have hardly any flu this year, and we think it's due to the fact that people are wearing masks, keeping their distance, and avoiding congregate settings. Goes to show you that those types of public health measures actually work.
Dr. Fauci, we appreciate your time. You're welcome back anytime.
Yet, when you go to the CDC's data, the number one comorbidity is influenza and pneumonia, to the extent that there's more people that died with supposedly COVID and influenza and pneumonia than died with just COVID on the death certificate. So I'm thinking, well, then which one's the comorbidity? If 60,000 people in America died with just COVID on the death certificate, but over 500,000 also say influenza and pneumonia, I don't understand why that's not getting more attention. And the fact that we had people that were dying from this second affliction, this influenza and pneumonia thing, back in January, February, March, and the media was covering it. The media was showing you that there was this terrible influenza outbreak.
Couldn't be much more from the heart. Forever trust who we are.
Concerns over the flu. The first day of winter is still a few weeks away, but the start of flu season appears to be here, with between 1.7 and 2.5 million flu-related illnesses already reported. According to the Centers for Disease Control and Prevention, forecasts suggest that flu activity will continue to rise. There's a 40% chance it will now peak in December, which the CDC notes would be considered early compared to previous years.
Yes.
Give DJ.
We are definitely seeing a higher number of flu cases this year than versus last year.
In today's morning rounds, this flu season is on track to be one of the worst in recent history. In terms of the number of people infected, flu is now widespread in almost every single state, and nearly 10 million people have become ill so far. 4,800 of those people have died.
No matter how far, couldn't be much more from the heart. Forever trust who we are. Nothing else matters. Never open myself this way. Life is ours, we live it our way. All these words I don't just say, and nothing else matters.
Take a look. You see all that red? I mean, how could you not? That should be a red flag about just how bad this year's flu season has gotten. The CDC says influenza is widespread in all but 2 states and Washington, D.C. It's that map, that rampant spreading virus we should be worried about. But in the last week, most of what we hear about when it comes to health news is the coronavirus.
Now, you went through all this stuff with Tami sort of a full year later, right? So this was January of 2021. Of 2022. So this was 2022. Yeah. So this was almost 2 full years after, right. Which is why, and you guys were, thinking it's probably not that. It's fully right. 2 years on. And so there's this remarkable thing that happened, which I documented. I don't know if you've watched any of these videos, but the influenza disappears supposedly from over 100 countries on Earth in the same 4 weeks. That seems a little suspicious. I mean, there was no campaign. They didn't have posters up telling you and do this so that we can also get rid of influenza.
Seems to come down from long ago. Too friends having coffee together when something flies by their window. It might be out on that lawn, which is wide at least half of a playing field. Because there's no explaining what your imagination can make you see and feel. Your body means nothing, and you'll be hypnotized. It's not a meaningless question to ask if they've been and gone. I remember a talk about North Carolina in a strange, strange pond. You see, the sides were like glass in the thick of a forest without a road. And if any man's hand ever made that land, then I think it would have showed.
The stand 6 feet apart and the stickers on the floor at the Walmart and all that was how you were going to eradicate COVID, and we didn't. We have 1.2 million people dead. So whatever it is we did with the hand washing and the masks and the stand 6 feet apart led to 1.2 million supposed COVID deaths, but it eradicated influenza? Well, that sounds odd, and here's why. SARS, the first SARS-CoV thing, the first coronavirus, SARS-1, didn't kill 1,000 people. And MERS didn't kill 1,000 people. So when this coronavirus shows up, and all of a sudden it's killing thousands of people, I went and looked at China, because I never heard of Wuhan. Forgive me if I'm an ignorant, does that make me racist? I never heard of Wuhan. I guess I'm a racist, right? So I never heard of Wuhan. So I looked so I looked at Hong Kong, and I looked at Shanghai and Beijing, and none of them had 10 dead. And I couldn't understand, well, then why is everybody making such a big fuss about Wuhan? Okay, there's a big outbreak in Wuhan, never heard of Wuhan. Are there more than 5,000 people dead in Wuhan? No. So why is everybody freaking out over this? And what it started to appear to me, but in America, we had so many people dying of influenza. 4,000 people a week. And I couldn't understand this. And then I found this article by this Google fellow, a guy named Ray Kurzweil, who's kind of famous. He invented the scanner and all that stuff. And back in 2005, he's calling out Dr. Fauci and saying that Dr. Fauci is about to resurrect and publish the 1918 Spanish flu genome. They dug it up, they sequenced it, and now that they've got it, they're going to put it in GenBank so that anybody can come up with it and do stuff with it. Well, that was 18 years ago. That was 2005. Dr. Fauci publishes this thing. That was the deadliest respiratory virus man has ever seen, right? The two deadliest viruses are smallpox and the H1N1 influenza. But smallpox is not really a respiratory infection, right? It's an infection of the skin. So the H1N1 is a respiratory infection that presents like COVID. It's pneumonia, right? And when I started studying this H1N1 from 1918, I found a paper that called it the Blue Death, because people's lips were turning blue, and they said it was like altitude sickness. I'm like, well, that's what Dr. Cameron Kydell is talking about. Cameron Kyle Seidel was telling us it's like altitude sickness. Their lips are blue, and they're hypoxic. And I'm reading about the Spanish flu, and that's what it says it was doing. And then I started thinking, well, wait a second. If this Spanish flu thing got out of the lab, would we admit it? Or would we try and cover it up and blame China?
Dr. Fauci, is it's been 100 years since that lethal 1918 flu, and you're saying there could be one virus that could be catastrophic.
would we call Peter Daszak and say, hey, Peter, we need another virus that kind of looks like this one, because a whole bunch of people are probably going to die, and we don't want to take responsibility and let people know, yikes. That's one of the things we did at Walter Reed Fort Detrick. That's why Redfield closed Fort Detrick. When Redfield was the head of the CDC before Walensky, he closed Fort Detrick. It's a bold move.
Yep.
People, when I was CDC director, one of the most difficult things I had to do as a 20-something-year Army vet was shut down Fort Detrick. It wasn't very popular. These people were my friends, I knew them, but our inspection showed that they were cutting corners in their biosecurity requirements. And I felt that we weren't going to take that chance with the Frederick community and beyond. And so I shut the lab down for 4 to 6 months until they corrected their biosecurity. So I think this is much more complicated than people think. And if we are to go down that path, I would argue there's a few labs in the world that should be with multiple redundancy in containment to do this. But I'm not convinced it's to an advantage, and this is why in the Wall Street Journal op-ed I did, I strongly recommend that we have a moratorium on gain-of-function research, similar to what we had in the Obama administration.
I completely agree with you, John. There, as you continue to compile this data, it just becomes more and more glaring, the levels to which they were willing to keep this under wraps and do all they could to hide the truth behind it by erecting other, whether it was this new virus that they had on hand ready to go, or whether it was a protocol in place to isolate people and keep them. Why wouldn't you let a patient advocate be in the room? Why wouldn't a parent or a loved one be able to be in the room? The reason is because they're going to treat your loved one in a way that you would never agree with. And so they couldn't do it with you present. It all fits the narrative, right, with what you're talking about. I asked that question of Dr. McCullough. I said, how is it that Nigeria has less dead than Rhode Island? He didn't have an answer. No. I said, how is it that the West adopted such a deadly theology of how to take care of people in this and suffered such high level of death? Why did we do that? And other countries didn't suffer the same way. If this virus, was it that smart? Did it just run around and knew who to go after and who not to? No. So even if you said, to your point, because this all ties together, right? If you said, she had the Spanish flu. No matter what, when she went to the hospital, she wasn't treated properly. Because they had a protocol in place that they were going to follow based on the incentive models that were presented to them. And they were going to follow it. And this is the secret that's not being talked about, along with the fact that the flu was eradicated overnight and probably replaced by the H1N1 Spanish 1918 flu. They had to cover it up just like they have to cover up everything else today in this world. I said to the panel, I said, it's a conspiracy until it's not. That's not my phrase. It's an old phrase. But the truth is, all these things are conspiracies until they're not. And, Elon Musk, frankly, could solve this by opening the Twitter files, because I promise you there's communication between these agencies and these individuals about all of this stuff.
I guarantee it.
We wouldn't need subpoenas. We don't need to worry about the PrEP Act. We don't need to do any of that garbage. If he just would open the files, we would have the answers. And so part of my presentation was that, let's have that conversation. Let's elevate this to a level that gets someone else engaged. So because you, my legislator, you're at a different pay grade. You can at least subpoena people. I can't. But you're not going to get there because they're going to block every subpoena, or they're going to redact every document that you do get. So what we need is someone like Elon to do the work. But to your point, if this was the case, and I'm more than comfortable with going along with that premise, because Tami was not. It was 2022. This was a healthy, beautiful woman who had no underlying conditions, living our best life, and all of a sudden hit with something that normally would be treated one way or another. But when we got in there, it only fit one box. It didn't matter about
we both know her cause of death was due to 15 days in a hospital bed, not a respiratory. She didn't die from her lungs.
Nope. Not at all.
She died from being in the hospital, and I mean, I don't know that they have a leg to stand on. I mean, I don't think they have legs.
Well, I don't know.
Yeah,
the problem is you and I might be right in that case, but no attorney will touch this because of the PrEP and the CARES Act.
Tell us about this. Tell us about this, because you said that you learned a lot listening to Aaron Siri talk about this, and that the indemnification is just unbelievable. Help us understand more about that, because this is new to me.
It is crazy. The amount of, so I use these silly sort of picture images to say, this is how bad it could have gotten, and I still can't do anything. I've many times said they could have stabbed my wife in the face with a butter knife, and there's nothing I could do because it would fall under the banner of public health. As long as she was being treated for COVID, didn't matter what they were doing to her, it would all fall under the public health guidelines that they were protected under in this indemnification that they initiated with the emergency use.
Well, which is which? Which is which? So start us with which is PrEP, which is CARES, and which one is doing the indemnity? Because I don't know the difference between the two. I never really dug into them. So you're educating me now.
So one is related more to the Emergency Use Act for the vaccination and anything that has to do with that vaccination. The other one is the public health measure, CARES, the public health measure that protects the public health and anyone associated with protecting that public health under the guidelines. As long as you are doing something that fits in those guidelines, so carrying a vaccine, injecting a vaccine, driving a vaccine, transporting blood, you're locking down in the hospital, not anything. The initial response from all legal personnel is, I can't fight government. I can't get past that indemnity. It all falls under the protection of this act. And so the challenges for all attorneys who may really want to do this, and let's just say there's cases out there like mine and even stronger cases where it's cut and dried. This is pretty straightforward. They forged a DNR of a 19-year-old girl in Wisconsin in order to get her moved through the process while they alienated the family from protecting her. This is documented. Glenn Beck had the father on his show, and they can't get a criminal case against the hospital or the doctors because everyone's protected under this act. Now, that ought to tell you all you need to know about how protected these people are. That's why moving this outside of the CARES, and so get away from the public health and get into the incentives and the corporate structure that built this mechanism in order to protect themselves from, let's say, the Spanish flu, and or covering up that incident. Let's do this. Let's put them in. Let's make sure that we have a hospital protocol. Here's another thing for you. I'm sorry for kind of rambling on that particular subject there, John, but I had a conversation with some folks that were the directors of the Pandemic Public Health Committee or group. They were the government's agency that in a situation like that, they would be called upon to have to let all the other agencies know how to act. That group was fired in January. They never got a chance to have an impact on anything because they were side railed and said, you're not part of the team anymore. They had to isolate that group because they had this other initiative.
Tell us more. I want to hear more about the event that you were at in Arizona and all these big shots who were there. Pierre Corey, Peter McCullough, Andy Biggs, Aaron Siri. For each one of them, give us a sense of what was sort of the highlight. In other words, Peter McCullough has an opportunity. He gets to speak. What was it that he said that really kind of impressed you, maybe took the air out of the room for a second, and everybody was like, whoa. You know, same thing with Pierre Corey. Kind of walk us through, as each one of them had an opportunity to speak, what was sort of that moment for each one of them that you were like, damn, you know, this is powerful stuff that he's bringing right now. Can you share that with us?
Yep, I think for most of us, if you've heard Peter McCullough talk or you've heard Dr. Corey talk, they have a pretty canned presentation. They hit the marks. They know the topics they need to expand upon. This environment, they were a little bit more free to have more conversational responses because the audience could be engaged. In other words, Dr. McCullough asked me questions after my testimony. So it gave us a chance to have a different level of conversation than what you're typically used to in testimony within the Senate or the House.
What did he ask you?
And
Start with that. Yeah. What did he ask you?
Yeah. And so in doing that, the most eye-opening portions for me from Dr. McCullough were he validated that the government and all the agencies involved had colluded for a particular manuscript of how they were going to manage this, from media to corporate hospital to traveling nurses to vaccination. Everything was choreographed at the highest level, and he validated that in that he received communication from those folks on how he was supposed to act at his clinics or where he was going to be a resident for that day or week or wherever. So he validated what many of us knew. He then went on to validate that the incentive structures around those protocols was in fact exactly what all of us knew, that this wasn't something that people made up, that they were being paid extra or bonuses like Dr. Jensen had described early on. He validated that again, saying, yes, this is exactly what was happening. And he gave his own dates and times for when he was notified and when he was present for that kind of communication. And then the last thing was that they had no idea how to treat this, or two things. They had no idea how to treat this at the local level because the information they were being given was about protocol, not a treatment. In other words, they weren't saying, yeah, you got it. So they weren't saying, hey, evaluate this person every couple of days. Let's try this, let's try that. And then we'll move these people through. This is what we think is going to happen. They just said, no, you're going to do these 5 things and they're either going to live or die. We don't care. The other portion that he brought up that was, I think, clear to everybody that you've ever talked to, or even you and I have had, there was no early treatment. In fact, early treatment was ruled out. They did not want to talk about early treatment. No therapeutic. It didn't matter what you wanted to call this or how it got here. They were just not going to treat it because it didn't benefit them in the end.
Well,
so
I have a theory about that. I have a theory about that. And I want to share it. I want to share it with you. So a lot of people are trying to get to sort of the heart of why did all this happen, and if it was a conspiracy and not an accident, right? So, at one end of the spectrum, you have this zoonotic thing happens in a wet market. Oops, it was an accident and 7 million people are dead, right? At the other end of the spectrum, you have, no, this was a purposeful release with an intent, which is conspiratorial, right? And from a conspiratorial perspective, if you wanted to pursue that, hypothetically speaking, you might look at some of the things like, for example, Hillary Clinton on March 18th of 2020 said we should probably vote by mail. Okay. Now that might be prudent if there were 20, 30, 40, 50,000 people dead from COVID. But there weren't 200 people dead.
Exactly.
Now, if there weren't 200 people dead in America from COVID, would voting be something you were terribly concerned about in March when the elections are in November? There's not 200 people dead in America. There's not 10 dead in Hong Kong. And she knows that. She's a former Secretary of State. She gets those daily briefings from the CIA, right? You know that when you're former something, you still get your clearance. Yep. Brennan still gets his stuff. Clapper still gets the stuff. So she's still getting the daily briefing. She knows there's not 10 dead in Hong Kong, Shanghai, and Beijing. If I know it, looking at the Johns Hopkins map, that means the CIA knows, right? They're in Langley. They got the same map I've got.
here, but now they're gone. Seasons don't feel the
So if they know that there's not 10 people dead in Hong Kong, Shanghai, or Beijing, she knows that. So why would she call for mail-in voting when we're not at 200 people dead yet? Doesn't that seem like we're jumping the gun? I could understand saying, hey, we got a couple 100,000 people dead from this thing. Maybe we should do mail-in voting instead of going to the polls. And you make that decision in August or September when people are still dying like crazy from this thing. Okay, then it might be irrelevant. But in March, when there's not 200 people dead, she's got a solution to the problem that has yet to materialize. She wants to have mail-in voting March 18th of 2020. There's not 200 people dead in America. Now,
what day did we determine that this was called an emergency?
Well, it was declared a global pandemic by the WHO on Wednesday, March the 11th. And on Friday, March the 13th, President Trump declares a national emergency. And there
How many were dead?
64. On Friday, March 13th, there were 64 dead in America. And Trump declared a national emergency in all 50 states.
Right along with your theory.
Yeah. So I don't think when he did that, I don't think that was about COVID. Now, it doesn't mean that there wasn't a pandemic. The data that I'm pulling from the CDC shows 4,000 people were dying every week in January, February, March of 2020. Well, we didn't have any COVID in America. And then when the COVID thing does materialize in China, okay, I hear what's happening in Wuhan, but until you guys have a couple thousand dead in Shanghai, Beijing, Hong Kong, why are you telling us? I mean, let us know. When you get to 5,000 dead in Hong Kong, 5,000 dead in Shanghai, 8,000 dead in Beijing, okay, now tell what's the problem over there? There weren't 10 dead. And yet we were carrying on as if something was crazy was happening. Maybe because 4,000 people were dying every week in America. And it was starting to get out of hand to the point that they're not going to be able to keep the lid on this much longer. We're either going to have to admit one of our gain-of-function viruses. Now, keep in mind, Fauci resurrected that 1918 thing, but he published it, which means any one of these crazy labs, Ralph Barrick, Yoshihiro Kawaoka in Wisconsin, these guys can monkey with the stuff, with the gain of function. They take things off and they put things on. And you start with the 1918 flu. And one of the things I asked Dr. Judy Mikovits, who used to work at Walter Reed, Fort Detrick, and I said, if you had that 1918 flu and you've got all those little bits and pieces on it, right? All that mechanical stuff, could you find the part that gives you a fever and take it away? Could you get rid of the part that gives you a fever? Because what Dr. Judy explained to me, and Dr. Roger Schwelt, when your body has a fever, it's producing the things that get you better, right? And one of them is interferon. When you have a fever and your core body temperature goes up, or when you get in the hot tub for that matter, Dr. Schwelt was explaining, your interferon production goes up. And that helps make you better. Well, if you did gain of function on the H1N1 1918 virus and you turned off the part that gives you a fever, how would you know you were even sick? And I'm talking now to you, Kurtis, okay? Yep. You're a man, I'm a guy. If I don't have a fever, if I'm not burning up in bed with this, like this, and I'm like, I don't even want to go to the bathroom. I don't even know I'm sick. Tammy was run down, but she didn't say, baby, I am sick as a dog. I am burning up over here. That's not what was happening. And it starts hitting me. It's like, wait a second. Do you remember when we were testing everybody around the country? You had to drive into like a huge parking lot at a Walmart or an arena. You'd go to like a baseball field, like Shea Stadium or Yankee Stadium, and they had people going through the line to get tested, but everybody was asymptomatic. What the hell were they testing asymptomatic people for? Unless they had what Tami had.
Yeah, I mean, I completely agree.
Think about this for a second. If 3 days before you went to the hospital with Tami, you guys just said, well, you know what? We're here. It's a drive-through testing thing. Let's just get tested. And she said to you, but I feel fine, you feel fine. Yeah, but let's just drive through and get tested, which is what we were doing back then.
Right.
Now they know how widespread this thing is. They know who has it and who doesn't have it. They know. You don't, when they were doing the swabs in the parking lots, we don't know what the hell they were testing for. They could be testing you for chicken pox. We don't know what the hell they're testing you for. We don't know where's that's going. Why were they testing all these asymptomatic people? Could it be that there was a strain of a virus that was causing people to be hypoxic, but with no other presentation? If you take the Spanish flu and you take off the thing that gives you a fever, how the hell would you know you had it? I wouldn't know. I wouldn't know. I just start feeling lightheaded because my blood oxygen was at 79. But other than that, and when you told me how Tami was presenting, I'm not a doctor in any way, not even close. But I'm thinking, oh my God, everything sounds like that minus the fever. And is that why they were testing tens of thousands, hundreds of thousands of asymptomatic people? It never made any sense to me. So I wanted to talk a little bit more about this event with some of the federal senators. So you said that Andy Biggs and Paul Gosar. I don't know which one of those is a senator. Which one? I think are they both senators? Are those no? Because you've got Kristen Sinema. She's the famous one, right? So
yeah,
she's the famous senator, and then the astronaut, right? You got Mark Kelly. Is he still senator? Or, yeah. So you got Mark Kelly and Kristen Sinema. So Paul Gosar and Andy Biggs must be the famous congressmen, I guess, from Arizona, because I've heard of those guys. I haven't heard of anybody else. And Paul Gosar is funny because he's the one where everybody in his family hates him, right? His sisters and his brothers, right? He's funny. Everybody says, Paul's out of his mind. And then there's Andy Biggs, and Andy Biggs has been a pretty vocal guy about, I guess, the border, right? He's one of these congressman who he gets in front of the camera. We've heard from this guy once or twice before, right?
Yeah, they're both doing yeoman's work when it comes to both the border and this as best they can.
Tell us about that. Tell us about the event and what kind of role did Andy Biggs play? Gosar, did they have any facts? Did they know what they were talking about? Were they just there for looks? Tell us more.
Yeah, so I mean, to be honest, they probably were there more they actually weren't physically present. They were in Washington still. If you remember that period, it was May 25th. There was a vote for the budget on the 27th, I think. So they had to be present, and there were some other calls to action that they couldn't participate physically, but they zoomed in and they made both some opening statements, and then they participated on Friday, which was the second day of the event. I wasn't there on Friday, so I didn't hear the closing arguments, if you would, or the statements from anybody. But frankly, I was exhausted, John. Having sat there testified for an hour, sat for 4 hours prior to that, listening to the testimony from the experts and going through the different legislative things that took place, and shaking my head and thinking, God, I can't believe we went through this, and then having to deal with the fact that, my wife is no longer here and I'm alone, and here I am standing here doing this. And I felt the weight of the world, because there was, being the only advocate to be able to do this, I wanted to make sure I represented everybody that might have gone through this the same way. And so it was laborious, and it was challenging. I didn't want to fail. I wanted to validate the people that had felt like they'd been thrown in a corner, and I wanted them to know that this was real and this happened, and I wanted to try and get those guys on record to state that was real. And I really only brought up Tami's testimony in the last 25 or 30 minutes of my own testimony in a way to try and not only put a face to it, but lay some facts around their own statements and sort of hold those guys accountable. So Gosar and Biggs were the heavy hitters, if you would. The rest of the local state senators are good people, honest, hardworking, good people that are trying to do something right and expose some of the failures of the administration and the agencies associated with doing this. But Gosar and Biggs are definitely the heavy hitters to come in. They both made great points and observations on what they have done at that level, at the federal level, all the different testimonies and hearings that they've had. They talked specifically about the early treatment being abandoned, the forced vaccination. Andy Biggs had no problem making statements around what you did around, driving mail ballots, what he felt about that stuff. That was part of the equation, that came out way too early and was the media was way too quick to jump on board and agree that, oh yeah, that's what we have to do and all this. So he felt very choreographed about it. He didn't have any problem saying stuff like that. So while he didn't lay any new ground or anything, he did validate for the most part all the opinions and feelings that most people have or have experienced in doing so. And it felt good from that perspective to have somebody at that level at least say it. The biggest challenge we have, and it's the one that you and I continue to try and figure out, is to your point, the action items. What's next? I mean, if everyone knows this and there's no confusion about the fact that these things occurred, I mean, you're talking murder on a mass scale. Call it whatever you want to call it, but that ultimately is what it comes down to. You killed people for some other reason, not because they were sick. These people weren't dying from their ailments. They were dying from the lack of treatment for their ailments, and the treatment they were getting was the one that was killing them. So,
and make no mistake, there were people who did have a SARS-CoV-2 infection and then were given remdesivir and died. So there were all kinds of pathways here that didn't make sense. But the one that you and I are so closely aligned on is this particular one where there may have been thousands or hundreds of thousands of people that didn't actually have a SARS-CoV-2 infection. And that changes everything. Everything. Right. So the challenge that I would put out there, and again, one of my frustrations is that because I protect my identity, my personal identity with the incognito crap, I'm not taken seriously by people like Peter McCullough and Pierre Corey. And that's just a cross I've got to bear. What am I supposed to do? The truth is, it's difficult to go argue a legal case if you don't really understand the fundamental facts, if you don't have all the data. And one of the things that I feel a lot of these attorneys have been doing is rushing into these cases without having all the facts. One of the things I brought up when we first started this discussion, I said, I didn't even know, how did Arizona do? Did Arizona do really poorly? Did Arizona do pretty well? I wasn't really tracking Arizona. I was tracking New York, California, Florida, Texas for the most part. Turns out I pulled up Arizona. 33,500 people died of COVID in Arizona. That's more than Pakistan. Pakistan has 220 million people.
Out of your league to side bitch out of your league to house so empty, need a centerpiece. 20 racks a table come from ebony. Cut that ivory into skinny pieces. Then she clean up with her face, but I love my baby. You talking money, need a hearing aid. You talking about me, I don't see a shade. Switch on my side, I took any lane. Switch on my cup, I kill any pain. Look what you got. I'm a motherfucking star boy. Switch on my side, I take any lane. I switch on my cup, I kill anything. Look what you done. I'm a motherfucking star boy. Look what you done. I'm a motherfucking star boy.
And Arizona's got more dead? I don't think Arizona's got 10 million people in the state. I think you guys are like at 7 million or something.
7 million.
Yeah, you don't have 10 million people. And you got more dead than Pakistan? And nobody's really making these comparisons because they're so uncomfortable. I'm looking at the number in Arizona now. 33,500 people, supposedly, died of COVID in Arizona. And less than that died in Bangladesh. Bangladesh has 168 million people and less than 12 toilets. And they've got fewer dead than Arizona. So these are these uncomfortable questions I keep asking. You know, we talk about Nigeria. Nigeria doesn't even have 4,000 dead. Nigeria needs to win an award or something. 220-something million people, and they don't have 4,000 dead. When I look at Nigeria and Pakistan and Bangladesh, and people tell me they can't count, I have to dismiss them as racist. All right? Bangladesh can count just fine. Most of the clothes that you wear are probably being made in Bangladesh if you shop at H&M. So they count just fine. Pakistan can count just fine. Trust me. Those are the real numbers. Those are the real numbers. You want to know how deadly COVID was? Look at Ethiopia. Look at Nigeria. Look at Bangladesh. Look at Pakistan. Look at countries that didn't really have a vested interest in the outcome of the 2020 election.
Exactly.
The countries that did have a vested interest in the 2020 election, something remarkable happened, something amazing, something that's never happened in history, Kurtis. Never. In a 4-week period, they eradicated influenza. We're talking in Germany, France, Italy, England. Norway, Sweden, Switzerland, all in the same 28 days, it's gone. How did that happen? No campaign, no posters, no money, and no attention and this is the part that kind of gets me upset, is nobody thinks that's relevant. The other big respiratory infection that kills people just disappeared simultaneously, and that's not relevant. We don't want to explore that further. Comparing the outcome, the public health outcome in Arizona to the public health outcome in some of these other countries, we see such a huge discrepancy between the countries that don't seem to have a vested interest in the outcome of the 2020 elections versus the countries that did. Like, we know Emmanuel Macron wasn't a big Trump fan, right? And, guys like that. So we see these very different outcomes. And in the countries that have huge COVID death numbers, like, for example, England, the UK, has more people. Well, just start with England. So the UK, Scotland, Wales, England, has more people dead than China. Well, how the hell did that happen? China's got 1.4 billion people, but the UK's got more dead from COVID, and the thing started in China. So I kind of keep looking at those sort of statistics to get to the heart of the issue, which I believe is that there were two pandemics, and that the one that Tami was infected with, the virus that she got infected with, is the one that Dr. Fauci had to cover up. And that's why there were two pandemics. I think everything related to Wuhan and SARS-CoV-2 and COVID and Peter Daszak and all that stuff is the cover-up. Because I'm afraid that the virus that Tami got infected with most likely came from Walter Reed and then got screwed with. They did some gain-of-function stuff so that it didn't create a fever. And if that got out, we wouldn't admit that. The guys in Langley would come up with some stupid plan to blame China. And they would say, well, there's got to be a virus in that lab where Peter Hotez works all the time, right? Peter Hotez goes and works in Wuhan with these people. There's got to be something over there that's similar enough that we could, put some of that out there and blame that. And who the hell is going to be able to tell the difference if we don't put the thing from Walter Reed in the PCR test? If the thing that we're trying to hide isn't in the PCR test, nobody's going to know you have it. Doesn't matter. You test me 10 times for the thing. If it's not in the little PCR test, it's got like a whole bunch of little spots that they test for different stuff like RSV and different strains of influenza. But it only tests for 5 strains of influenza. And the strains it tests for are the most innocuous strains, not the deadly ones. It doesn't test for the super deadly strains that only lunatics like Kawaoka are working with in laboratories. Those aren't in the test. So if one of those got out and you got infected with it, and they test you with this commercial test kit from Eplex, that's not in there. They're never going to know you have it. And I'll give you another example. Tami probably was never tested for tuberculosis.
Right.
How do they know she didn't have that?
Right. No, it's a valid point. I don't disagree with any of that.
The things you don't test for, you don't know if these people have. And so a part of sort of the, like you said earlier, everything sounds like a conspiracy theory until it starts coming true. When did we stop doing viral cultures?
Right.
Why did we stop doing that? In other words, if when Tami arrived at the ER, if they had said, you know what, your PCR is coming back negative. We think you've got COVID, but it doesn't. It says you don't. We're going to do a viral culture. We want to find out what is in there. What's got your blood oxy 79? This is wacky. We've never seen this before. Let's do a viral culture. It may take 3 or 4 days to get the results. It seems like everybody stopped doing that. And to me, that's part of this conspiracy, was this shift to PCR testing, knowing full well this pathogen is not in the test. It's a BSL-4 pathogen. It's like Ebola or Marburg virus. They don't just send it out to all the manufacturers and say, yeah, and by the way, here's your 1918 Spanish flu. Ray Kurzweil was so upset, he wrote an op-ed piece in the New York Times with the founder of Sun, Bill Joy, the guy who founded Sun Microsystems, and Ray Kurzweil write this piece, and they said, Francis Collins and Dr. Fauci are out of their minds. They're going to resurrect this thing. If this gets out, Kurzweil says this, 5 or 10 million people could die. Isn't that what just happened? Isn't that what just happened? And a coronavirus has never killed more than 1,000 people.
Right. Exactly.
So as bad as these protocols were, and again, I'm now you've got me thinking, who the hell wrote this CARES Act? I want to find the authors. I think that's one of my projects this week.
Number one question on my list is who authored this structure and who authored the incentive plan to support it.
That's it. So that's what I'm going to be digging into this week. I want to look at who authored the CARES Act. Where did all this guidance come from? Who came up with this notion that we're going to need ventilators? We heard Dr. Cameron Kyle Seidel tell us it's not their diaphragm. You guys are we don't need pressure. They're not processing oxygen. And then somebody came along later and said this needs to be treated kind of like a cyanosis. That's how we need to treat this. And then somebody said it's Viagra that opens up the capillaries. And believe it or not, that Viagra is a treatment for cyanosis and altitude sickness. I had no idea, right? I'm just repeating stuff I heard from doctors. So... and then, of course, there are these antivirals like Xofluza and Relenza that treat these bad things. But you were saying earlier that one of the things that came up was there were no therapeutics. They wanted to suppress the hydroxychloroquine, the ivermectin. It could have been Zithromax. It could have been amoxicillin. It didn't matter what it was. They didn't want to hear about it. And I think, again, the reason for that was... we weren't at November yet.
Right. They couldn't, they had to drive fear. They had to have everyone scared. They had to have people dying. So the whole thing about building a protocol around more, death, for lack of a better term.
And no therapeutics. No therapeutics.
No early treatment, no therapeutics. We put them in a prison, in a hospital. We roll them through these 5 things. They die in 10 to 20 days, and we move on to the next one. Media spikes everything about death, COVID. Never talks about flu being gone, and then says, oh, by the way, we can't be at our Thanksgiving together, and we're going to have a mail-in vote in order to manage our elections for our policy going forward.
Now, as soon as we had mail-in voting, as soon as that was complete, we moved into a baton zone. We moved into this new baton zone where rather than talking about therapeutics, we now had inoculations. So December of 2020, forget about those therapeutics, forget about the horse paste. We've got shots now. We got Pfizer, we got Moderna, we got J&J, we got all kinds of stuff to choose from. Forget about the therapeutics. Just get a shot. Just get a shot. Just get a shot.
So let me give you my opening statement in the Senate hearing, John, was I wanted to give a little bit of context, so it was off the fly. But I said, I want you guys to know I'm not some whack job. I'm a business analyst. I work in the HVAC commercial engineering space. I deal with data and solutions all the time. And when I look at this, I'm constantly surrounded with what appears to be idiots running things. I can't figure out how come when we saw a particular metric, we didn't change, pivot, or transition. We just kept doing the exact same thing. I said, and when I look back at it, I think, well, that was kind of by design too, maybe that's exactly what they wanted in the outcome, was to just have people confused and asking questions and going and all that. I said, it almost feels, and I'm not going to say that's what it is, but it almost feels like this was a military operation, that you set in stone a particular outcome. You laid the groundwork for what you were going to have happen. You knew the devastation that was going to occur, just like going in and taking the town, a city, or dropping a bomb on civilians. It doesn't matter. You know what the outcome is going to be, but the expense is going to be. But the outcome looks, I win the city, I win the whatever. And in this case, they wanted to win at something else, and they didn't mind the cost associated with doing it. And so they had to build in these metrics and different components that the media could champion. They couldn't have therapeutics work. They couldn't have an early treatment. They couldn't solve anything in the hospital. And they certainly couldn't have anyone in there advocating while you were in the hospital. They had to force you onto ventilation. They had to give you a drug, which, by the way, here's another question for you. How many senators and Congress people were invested in that remdesivir?
Oh, it's Gilead. So that's something.
Gilead, whatever it was, whoever
Gilead,
it was.
yeah.
What was the financial reason that was the only one drug that was used and no other drug was approved for utilization as part of the protocol?
And it failed its original use case. Right. So it was designed for Ebola and it did not receive approval. It failed.
And then you look at the vaccine that Bill Gates comes out and says, oh, yeah, it never worked anyway, after he cashes in $400 million on his stock holding.
Oh, at least that. At
So
least that.
He drove the market to a point like all the other people that had investments. So that's my point, right? These people had this financial incentive, whether it was the hospital, whether it was an agency, whether it was an individual, whatever. All of these people, and I hate to say it, conspired to create this thing. Once they knew they had to cover something up, once they knew they had to drive an outcome, they knew whether it was the election issues, which I believe it was, and whether they had to cover up for the release of something that they knew they had done, but couldn't have it come out. They had two-pronged, maybe three-pronged approach that they had to cover up and get done. They organized rather quickly. That's why I say a military operation. You got your general, you got your commandos, your battalion chiefs, and you got your grunts, and you tell them exactly what's going to. The enforcers. That was the other piece of this. How come why was it so quickly enforced across the country? And why were the enforcement mechanisms all doing you can't tell me that a sheriff in Durham County woke up one day and decided, hey, I'm going to protect every hospital in Albuquerque, New Mexico, the same way Durham is, or, Albuquerque is, without talking to somebody.
Well,
that was a top-down
I'll tell you what I think happened. I think Pierre Corey was kind of at the heart of it. And he because these guys are kind of afraid to look at my work, or they're afraid to acknowledge it. They look at it, but won't talk about it. I don't know what they know and what they don't know, right? So because they don't acknowledge it, I have to assume they don't know. Pierre Corey is one of the guys who came up with this treatment regimen, right? And it worked.
It worked. I saw his testimony.
But Fauci wasn't expecting that to happen. Fauci's got the deadliest virus on earth. And Corey, so here's the thing. Pierre Corey thinks he's treating virus A, and he's not. He's actually treating virus B, and he gets it right anyway. And this is something Steve Kirsch picked up on. When I was talking to Steve Kirsch, he's like, so wait a second. He's like, so hydroxychloroquine then is effective against potentially the Spanish flu? I was like, yes, but Pierre Corey doesn't know that because he doesn't realize that there were two pandemics at the same time. So these guys and whether it was Pierre Corey or Zelenko or whoever, these guys came up with treatment protocols somewhat by accident that appeared to be both effective against this SARS-CoV-2 thing, which I don't think is as deadly, and this influenza virus, which Fauci isn't expecting this to happen, let alone in March or April, that they've already got something that appears to be effective. That ruins Hillary's plan. Hillary's got mail-in voting. There's only 180 people dead. If all of a sudden it turns out that Zithromax works against this thing, that ruins the plan. It can't be amoxicillin or Zithromax or anything that's generally available.
Right.
Then this thing's going to be over by June. We can't have this thing be over by June. There were no therapeutics. None. To the extent that anything that showed any potential therapeutic value was ridiculed.
Yeah, and you were canceled.
Regardless, hydroxychloroquine, ivermectin. Had it been Zithromax, then they would have figured out a week later Zithromax causes cancer. They would have figured that out.
shut you down, shut down the distribution.
So when you see these pieces of evidence that start to compile, they start to come together and they start to fit, like you said, it sounds like a conspiracy theory until it all kind of starts fitting together. Like it's not a theory that there weren't 200 people dead the day that Hillary said we should vote by mail. Those are facts that we get from the CDC. We know how many people died with influenza pneumonia on their death certificate next to COVID, 527,000 people. That's a huge number.
Yeah.
But they're calling some of these deaths COVID deaths, despite the fact that some of these people never tested positive for COVID. And I'm wondering, in that first spike that we saw, like in March, April of 2020, we didn't even have functioning tests.
No.
So how did we know that those people were dying of COVID? Or was this, like Dr. Scott Jensen told us, that the new guidance was, if it looks like a duck, it's a duck. And he was like, what? You can't just you can't do that. You've got to be more definitive. And they're like, no, if it looks like COVID, it's probably COVID. Put that on there.
And they got away with it. I think there's a couple things that come out of what you just described. And one is I'll just state the obvious. If you think you know everything about how we got here, you're a special kind of person, because look what we know today that we didn't know just a year ago. While we may, and I'm saying this in this context, January 6th was a conspiracy until it wasn't. The origin of the virus, according to the media and all government agencies, was a conspiracy until it wasn't. The cancellation of right-wing people spreading rumors and disinformation was a conspiracy amongst the social media until it wasn't. All three of those things have one thing in common in terms of their exposure, and it's Elon Musk's Twitter files allowing that to be uncovered. The point is, if you think you know everything about how we got here, why we stayed in this, and what the outcomes, that you're crazy. You don't. There's so much that while we know it, we don't. It's not public yet. It will be at some point, hopefully, if somebody develops a conscience and sees the value in doing so. But the other thing is, from a psychology of human behavior standpoint, people would say, well, you're crazy that they conspired to do this. So they had some large group of people, cartel, WEF, they need all these agencies to operate in a certain way. Well, you just made a point that I think most people miss. And that is that a lot of this happens by accident, but you can predict it it's sort of a cause and effect position. If you burn your hand, you know that the next time you're not going to touch the stove. I'm not going to burn my hand again. And while that's a silly analogy for a second, stay with me. If I tell you that there's no treatment, and the only treatment that we can support is this treatment, I know that people are going to act a certain way. The pharmacists are going to act a certain way. The other people are going to act a certain way. The media is going to act a certain way. I don't have to have a meeting with every one of them. I just have to put that out there that this is going to be, this is the outcome we're looking for. And here's how, what we see is happening. And we will get people to the psychology of human behavior. They're going to change. They're going to do exactly what they're told.
Oh, yeah,
and they
absolutely.
don't even realize what they're doing.
Well,
they didn't need
pressure.
10 people in a room. Yes, exactly. They didn't need 10 people in a room in the pharmaceutical industry or in the whatever industry to make this happen. All they needed was the outline, the framework of what it needed to be. They needed an incentive structure in the beginning, because you can't change a 100-year-old hospital historical business model overnight without replacing that current revenue stream. So they needed an incentives plan to convince those guys to operate in a certain way. They couldn't have a solution, or else there was no way to get a vaccine into the arms of everybody and around the country. They couldn't have this solved because there was no way that they would have mail-in ballots. They couldn't expose how we got there, because it would uncover all the people that were engaged in the Spanish flu mechanisms along the way. And you would uncover all the colleges in America and things like that. Their biolabs that were doing it. All of those things couldn't unravel because the outcome that they were looking for was still only one, maybe two things. But as soon as they put it out there in the public sphere and said, this is where we want to go, they got all the mules to line up and start acting a certain way. They didn't have to coordinate it. And that's what people miss. They want to say, oh, it's all, you're a nut job, it's conspiracy, because all these people would have to act this way. They'd have to have all these coordinates. No, they wouldn't. They wouldn't.
It's a handful of people. It turns out there's a handful of super powerful people who, because the media isn't really the news anymore, right? So because the media is Disney and cable, or Comcast or whatever, and that these are the companies that own what we used to call the news. It's, what we're finding out now is that the news has been very filtered and very one-sided. They're doing a lot of censoring, and people aren't really getting to hear the full story. And as you said, all you need is a couple nights of the news referring to it as horse paste, and there's not a doctor who's going to talk about it. They don't want to be associated with it. All the physicians are going to say, I don't, come on, I don't even want to go there. So that's the ridicule, the public ridicule of all these therapeutics allowed this thing to carry through to November. And the truth is, the death rate started to dip in the summertime of 2020. June, July, August, deaths were going down. And so I'm sure Hillary was terrified, right? Because, what are we going to do now, Barack, if everybody doesn't, They really didn't want those therapeutics, and that was another aspect of this. And again, the fact that Pierre Corey and a bunch of these guys figured out, that they could treat it, kind of blindly, that they kind of figured out some sort of treatment regimen, and then the fact that potentially it treated one of the deadliest viruses we've ever seen is just something that Fauci wasn't counting on that. They weren't counting on that happening. And so that was a big monkey wrench. And that's why you saw the reaction was kind of overblown. And everybody was like, why wouldn't you want to check that out? Why, guys like Brett Weinstein and Heather Heying are like, why wouldn't you want to explore this? If this is effective and it's safe and it's award winning, why are you not exploring? Nobody, it's like it started falling apart, man.
The question is, given all of the evidence, circumstantial, inadvertent experiment as it may be from, all of the evidence that this appears to have a mechanism for action and appears efficacious in preventing both the spread between people and the spread within a person, why on earth would you not run a very large study that would tell you for sure how good this was and how best to use it?
Yeah, why wouldn't you?
Why wouldn't you?
And wouldn't it be a legitimate word to use that it would be criminal if you didn't, if you knew that it would be a good idea to do so? Well, as it turns out, if ivermectin were an effective treatment, the vaccines never would have gotten emergency use authorization in the U.S. There's just a downloaded version of the document from the FDA, Emergency Use Authorization of Medical Products and Related Authorities, Guidance for Industry and Other Stakeholders. So I'm going to scroll down. This is from January 2017, expires in 2022. This is still the guiding document. Here we go. Criteria for issuance. Under Emergency Use Authorization, Medical Products, 1, criteria for issuance. There are a few. It needs to be a serious or life-threatening disease or condition. There needs to be evidence of effectiveness. There needs to be a risk-benefit analysis. And D, there need to be no alternatives. I quote, for the FDA to issue an emergency use authorization, there must be no adequate, approved, and available alternative to the candidate product for diagnosing, preventing, or treating the disease or condition.
Yeah, the crazy thing was those are brilliant people you just mentioned, and yet their voice was completely silenced.
As if they were the conspiracy theorists. They're the conspiracy theorists. I'm the one citing Johns Hopkins. I'm showing the Johns Hopkins map, says there's not 10 dead in Hong Kong. I'm the conspiracy theorist.
Right.
So I did a show with Jason a couple of weeks ago, and I said, when does the conspiracy theory become the mainstream narrative? And and so one of the examples is China is lying. Meaning the data you see from the WHO and the data you see from Johns Hopkins, don't believe that. China is lying. Well, that's a conspiracy theory. What makes you think China's lying? What makes you think the WHO doesn't know how many people are dead in China? People don't want to accept the extent to which they were lied to by their government, by people they trust, like Rachel Maddow, who said, if you get the shot, you're not going to get sick. Man, she didn't know what she's talking about.
You said the same thing.
Right. So the people who believed all this hook, line, and sinker, it's very hard for them now to face the music and realize they were lied to by people they trusted, and that the government potentially has covered up something that killed 1.2 million Americans, and that the proper course of treatment wasn't followed for a political agenda. Right. Now, I want to leave you with this last thing. We only have a couple more minutes before we wrap up. The CARES Act. The CARES Act is indemnifying these people for all the things they're doing related to the COVID pandemic. And I want people like Aaron Siri and all these attorneys out there, Viva Fry, I want them to explore, but what if my wife didn't have COVID? You're not indemnified. You're indemnified if you're treating COVID patients. But as I said earlier, you don't get to just give chemotherapy to people who don't have cancer. You're not indemnified from that. So, for example, when you go to war and we teach soldiers how to shoot and kill people, that's okay if they're shooting and killing soldiers. But if you go shoot a child overseas, you're going to get prosecuted for murder. So there's a line. And the question is, in the CARES Act, where is the line that represents malpractice? You can't tell me, right? You can't tell me that any form of malpractice has been just eliminated. Right. That can't be the case. So at some point, there has to, even if it's a tiny little box where, well, if we did this and we did that, well, then we're not indemnified. Well, I can guarantee you, treating somebody for a condition that they don't have, that has financial ramifications and benefits behind it, I will convince the grand jury, and you can just sit there and watch. I can convince a grand jury that the CARES Act cannot rule in this situation, certainly when somebody comes in and does not have COVID. So
I can't wait for that day, John. I value you so much in terms of the way, for a lot of reasons, but your commitment to doggedly pursue the data and take it wherever it leads, and stand up in the gap for folks that don't have the platform or the voice to be able to reason this way. I really appreciate you for that. If you don't mind, I'll just tell you the name of the Senate hearing was called the Novel Coronavirus Southwestern Intergovernmental Committee. That was a long title. NCSIC is the acronym, but Novel Coronavirus Southwestern Intergovernmental Committee. And it was the first federal and state joint committee on the public response to the coronavirus in Arizona. And you can find my testimony, 100% of the whole thing, on just Google, put my name in Rumble, and I'm sure it'll come up. Senator Shamp, who headed the hearing, is also on Rumble, I know for sure, and on Twitter. I think you'll find links to the testimony in there too. So anybody that wants to hear from the beginning to the end, and the questions that were posed, it's all on there.
That's great. And are you going to be speaking at any other events? Have you been invited as a participant to any other?
Yeah, I've got an event coming up in November here by the Frontline Nurses Association people. I can't remember the name of the group particularly, but it's coming up in November. I'll be speaking on that. And then I'm driving a 9/11 style commission to create a report on this. And I'm doing that over the next 90 days.
That's great. Well, if you've got anything to share with me. I'll send it out on Twitter so that the audience can get to see that. And again, I can't thank you enough for coming on and sharing your experience with the legislature in Arizona covering this.
Hopefully there's some value in some of this that we talked about. I appreciate you.
I appreciate you, my friend. I mean, doing what you're doing is as hard as it gets. And, but again, we can't stop. If we stop, they win. And so that's why we can't stop. I can't let these guys win. So I can't thank you enough, my friend.